I will start the today's lecture, Clinical Pharmacy Part 1, Chapter number 3, Common Daily Terminology Used in the Practice of Medicine. Means medical terminology allows all medical professionals to understand each other and communicate effectively. When everyone understands what a condition, medicine or procedure is, they are able to fulfill their role accordingly, whether that is delivering medicine or billing for medicine. And first point of this chapter, introduction. At present, the job and practice of the compounding has largely been taken over by the industry. Nowadays, pharmacists divert more to patient-oriented services. The role of the pharmacist in counseling and health education has been appreciated. A general physician would expert to take a care of dosage requirement and adjust dosage form and helps the patient to understand how to take or apply them when required. याच्यामध्ये काय सांगितलंय तर आत्ताच्या कालावधीमध्ये फार्मासिस्ट हा पेशंट ओरिएंटेड सर्व्हिसकडे जास्त डायव्हर्ट होतो आणि फार्मासिस्टचा मेन रोल काय आहे तर काउन्सिलिंग करणं आणि हेल्थ एज्युकेशन रिलेटेड ॲप्रिशिएट करणं. हिअर आर द चार्ट ऑफ द commonly used dosage form. Dosage form. Firstly, what is the dosage form? Dosage form is the transformation of the pure chemical compound into a predetermined form by admixing drug compound with different kinds of the non-drug components collectively known as the adjuvants, each having a specific function. For example, tablets, capsules, syrups, suppositories, and creams. Three type of the dosage form. First, solid. Second, liquid. And third is semi-solid. Then, now see the solution. Solution is a liquid preparation that contain one or more soluble dissolved in a specific solvent. Liquid is a liquid mixture in which major component, मग ते मेजर कंपोनंट काय असू शकतं सोल्यूट अँड इज युनिफॉर्मली डिस्ट्रीब्युटेड विथ अ मेजर कंपोनंट इज द सॉल्युट. मायनर कंपोनंट कुठला तर सोल्यूट आहे आणि तो युनिफॉर्म डिस्ट्रीब्यूट कशामध्ये होतो तो मेजर कंपोनंट सॉल्यूट. देन सेकंड, ड्राउट्स. इट इज अ सिम्पल सोल्युशन कंटेनिंग अ सिंगल डोस इन अ सेपरेट बॉटल. Then drop. It is generally for vitamins and antibiotics formulation for pediatric purpose. Pediatric purpose. It is a branch of medicine that involves the medical care of the infant, children, and adolescents. Then next is linctus. Linctus is a cup preparation containing expectorant in a vehicle of simple syrup. The linctus is used for the taken to relieve cough and store throats. It is helps to relieve dry cough. Then syrups. Syrups are concentrated aqueous solution of the sucrose or other sugar. They may be viscous in the nature and sweet in the taste. Then next is elixirs. Definition is elixir are the clear, flavored and sweetened hydroalcoholic liquids. Elixir, it is used for the medical purpose to taken orally and intended to cure one's illness or disease. Then next is liquid. Liquid is a substance that flow freely but is a constant volume having a consistency like that of water or oil. Then subtypes mixture, tincture, emulsion, suspension, liniments, lotion, enemas. First, it is a liquid medicine for oral use of the which several dosage are contained in an aqueous form. Then tinctures. Tinctures are alcoholic or aqueous extract obtained from the botanical parts of the medical plants. Then emulsion. Emulsion are heterogeneous liquid dosage form in which immiscible liquid is dispersed with the help of emulsifying agent in the continuous phase. Then suspension. Suspension is a coarse dispersion containing finely divided insoluble materials suspended in a liquid medium. Then liniments. Liniments are the liquid or viscous preparation intended for the external use. Then lotions. Lotions are the alcoholic or aqueous or liquid intended for the external application. Then enemas. Enemas are the aqueous or oily solution administered in the rectum to cause a evacuation. These are the liquid dosage form. Then next is semi-solid. Semi-solid is falsely solid or semi-solid is the physical term for the something whose state lies between the solid and a liquid. Then subpart is ointment, creams, paste, polites. First is ointment. Ointment are the soft, semi-solid, greasy preparations intended for the external application to skin with or without rubbing. In this, ointment are applied on the skin with rubbing or without rubbing. Then creams. Creams is a viscous emulsion of semi-solid consistency intended for the external application. Then paste. Paste are the ointment-like preparation for the external use containing high percentage of the insoluble solids. Then poultices. Poultices are soft, viscous and pasty preparation applied to the skin when they are hot. Poultices means काय? A soft moist of the material, typically consisting of the bran, flour, herbs, etc., applied to the body to relieve inflammation. Then next is solids. It is a substances or object that is a solid rather than liquid or fluid. Solid dosage form mostly available in the unit dosage form such as powder, snafs, capsules, tablets and pills. First is powder. Powder is used for the external use. Powders are the homogeneous mixture of the drugs and chemicals in a dry and fine state. Then snufs. These are powders which are insufflated in a nasal cavity. Insufflated in nasal cavity means blow or breathe air, vapor or a powdered medicines into or through a body cavity. Then capsules. Capsule medicaments enclosed in the shell of gelatin. These capsules are the enclosed in shell of the gelatin. Then tablets. Tablets is the form containing a medicament with or without pharmaceutical aids prepared by compression. Tablets are prepared by compression machine. Then pills. Pills are small, round or egg-shaped bodies for oral administration. Pills in the form of small pellets. Then next is commonly used pharmacological terms. First is analeptic dosage form. Definition: drug that stimulates CNS and respiration. Analeptic is a restorative drug. Raise the level of physiological or nervous activity. Then example of the analeptics is caffeine and aromatics. Then next is anesthetics. Anesthetics is the substances that include insensitivity to pain. Definition is the anesthetic are the drugs that produce anesthesia, abolish the sensation of the pain. And then example is the thiopental propofol. Then next is antacid. Antacid drug that normalizes that hypersecretion of the acid in stomach or neutralize the hypersecretion of the acid in stomach. Then for example sodium bicarbonate, aluminum, calcium, magnesium. Then next is astringents. Definition is drug that cause precipitation of protein. Astringent causing the contraction of the skin cells and other body tissue. Then carminatives. Definition of carminative is drug which expel the gas from the GIT. Example is the TR cardamom aromatic waters. Then next is chemotherapy. Chemotherapy definition of the chemotherapy is drug that like kill microorganisms and pathogens multiplying in the host cell with chemotherapeutic agent. The treatment of the disease by the use of chemical substances, especially the treatment of cancer by cytotoxin and other drugs. For example, rifampicin and streptomycin. Then next is chalogoguse. Definition: drugs help in the evacuation of the gall bladder, which promotes the discharge or bile form of the system, purging it downward. For example, ipecac and calomel. Then next is diuretic. Definition: drug which increases the excretion of the water and electrolyte with flow of the urine. For example, theophylline and thiomersal. Then next is emetics. Emetics drug which induces the emesis. Better example is the bitters and ipecac. Then next is the hematinics. Hematinics definition: drug which increases the information of the blood and hemoglobin used in the treat iron deficiency anemia. Example are the iron ferrous gluconate. Then next is the purgatives. Drug that promotes the evacuation of the bowels and it is used to prevent the constipation. For example, senna and castor oil. Then tranquilizers. Definition: what is the tranquilizers? Tranquilizers drugs that reduce anxiety and produce the sedation. For example, diazepam and lorazepam. I will stop here. आजच्या लेक्चरमध्ये आपण काय काय बघितलं तर इंट्रोडक्शन, कॉमनली युज्ड डोसेज फॉर्म, देन कॉमनली युज्ड फार्मॅकोलॉजिकल टर्म्स. इंट्रोडक्शनमध्ये काय काय होतं तर आजच्या कालावधीमध्ये फार्मासिस्ट हा पेशंट ओरिएंटेड सर्व्हिसकडे जास्त डायव्हर्ट होतो. देन सेकंड काय होतं तर फार्मासिस्टचा रोल काय आहे तर काउन्सिलिंग करणे आणि हेल्थ एज्युकेशन रिलेटेड ॲप्रिशिएट करणे. देन नेक्स्ट काय बघितलं तर लिस्ट ऑफ कॉमनली युज्ड डोसेज फॉर्म. त्याचे 3 टाईप आहेत: सॉलिड, लिक्विड अँड सेमी सॉलिड. देन लिक्विडमध्ये कोणकोणते तर मिक्सचर, टिंक्चर, इमल्शन, सस्पेन्शन, लिनिमेंट्स, लोशन अँड इनेमास. तर त्याच्यानंतर त्याच्या प्रत्येकाची डेफिनेशन बघितली. देन सेमी सॉलिडमध्ये त्याचे सब टाईप कोणकोणते तर ऑइंटमेंट, क्रीम, पेस्ट अँड पोल्टिसेस. देन सॉलिड बघितलं. सॉलिडचे सबस टाईप आहेत: पावडर, स्नॅक्स, कॅप्सूल, टॅबलेट्स अँड पिल्स. देन कॉमनली युज्ड फार्मॅकोलॉजिकल टर्ममध्ये काय बघितलं तर ॲनालेप्टिक, देन ॲनेस्थेटिक्स, अँटासिड्स, ॲस्ट्रिंजंट, कार्मिनेटिव्ज, केमोथेरपी अँड चॅलोगोग्यूज, डायुरेटिक्स, इमेटिक्स, hematinics, then purgative, and last is tranquilizers. And त्याचं definition with example. Okay, thank you. And next part we will see on next lecture.